Um, Quite unfortunately, public health officials and doctors alike have been fighting these misconceptions about vaccines for literally decades now. And unfortunately, they've had mixed success. Um, there's numerous studies uh, finding no evidence supporting the notion that vaccine cause autism or other illnesses that people are worried about. Um, and now, due to this misinformation, we're finding immunization rates are falling, and preventable diseases are on the rise. So we're going to take a look at some of these common uh, pieces of misinformation that are out there and try to put them to rest. So the first big one that we've all heard about is this idea that vaccines cause autism. And this fear that vaccines cause autism comes from a 1997 paper published by a British surgeon named Andrew Wakefield. The article was published in a prestigious medical journal, and it suggested that the MMR vaccine was increasing autism in British children. Now, since then, the paper has been completely discredited. It has been retracted. Andrew Wakefield has lost his medical license. There is no reason to refer to this paper. Unfortunately, however, since then it's been taken seriously by a number of different groups and individuals. And while we aren't totally certain about the causes of autism, there's new reason to believe that the vaccine is involved, that any vaccine is involved. Symptoms of autism are actually observable before vaccinations are even being administered. It's possible that autism develops in utero. So there's really no connection there between autism and vaccines. Another big piece of misinformation is this idea that the infant immune system simply can't handle all these vaccinations. But infant immune systems are a lot stronger than you might think. Given the number of antibodies in the blood, a baby theoretically has the ability to respond to 10,000 vaccines at a time. Even if only the 14 scheduled vaccines were given at once, it would only use up a little more than 0.1% of a baby's immune capacity. And while this capacity is purely theoretical, the immune system could simply never be overwhelmed by these vaccines. The cells in the system are constantly being replenished. Babies are exposed to way more bacteria and viruses than they are vaccinations. This idea that the immune system can't handle it is completely nonsensical. The next big argument out there is that our naturally acquired immunity is somehow better than a vaccine-induced immunity. But this approach is really not tenable. You don't want to catch measles in order to later be immune against measles. There's simply too much of a risk. You don't want to risk your health and indeed your life when it's perfectly safe and reasonable to get vaccinated. Another big myth out there is that vaccines contain these dangerous chemicals like mercury or formaldehyde. And while it's true that mercury and formaldehyde are not good for us, only trace amounts of these chemicals are used in vaccines, and they're not even in the same molecular form as toxic versions of these chemicals. So ethyl mercury is in vaccines, but ethyl mercury is not mercury. It's at the chemical level, these things are going to behave differently, and there's no reason to fear them. The next myth is this idea that we need not vaccines. We just need more and better hygienic practices. We need better sanitation. And in fact, they say that the increased sanitary practices of our society over the past century or so is what is to attribute to the decrease in infections, not vaccinations. And while better sanitation, better nutrition, and of course antibiotics have helped, when you zoom in and look at how to attribute the causes of lowered infection rates, vaccines are simply undeniably the biggest contributor. Nothing has decreased the rate of disease and infection like vaccinations. It's one of the greatest developments mankind has ever invented. Nothing has contributed to the proliferation of human life in the way that vaccines have. Now, some parents might say that vaccines simply aren't worth the risk, that while all these things so far I've said might be true, maybe we still don't know enough and it's still just too risky. But that being said, there's never been a single credible study linking vaccines to any long-term health condition, be it autism or otherwise. It's not that it's not worth the risk. It's that there's no risk to worry about. There's no known risk attributable to a vaccine. As far as allergic reactions go, the incident rate is so negligible. You might as well be scared about going outside lest you be struck by lightning. We simply cannot live our lives in fear of vaccines when the risk is virtually zero. Some people might say that the vaccines, given that they are usually a attenuated form of a virus, are going to infect the child with the disease that it's trying to prevent. And yes, vaccines can cause mild symptoms related to the disease that they're preventing, but this does not mean the child is infected. It's very rare that symptoms occur at all, and when they do, what they're actually exhibiting are the body's immune response to the vaccine, not the disease's activity, but the immune system is activity. It's a demonstration that the immune system is working and the vaccination is doing its job in recruiting that immune activity. So again, no reason not to vaccinate your children. And so this last one, probably the least tenable argument against vaccines, is this idea that infection rates they're already so low. There's herd immunity. Why do we need everybody to get vaccinated? Well, there's essentially a psychological issue at work here. If enough people believe that herd immunity will save them, we will collapse herd immunity. If enough people stray from vaccinating their kids, then the herd immunity effect will no longer take place. Also, international travel is growing so quickly, even if the disease is not a threat to you and your community, it might be very common elsewhere. And if someone were to bring something from abroad, the unvaccinated individual is going to get sick if they are exposed. So vaccines are on all fronts absolutely necessary for the civilization that we have built for ourselves. All of these arguments being raised in rejection of vaccines must absolutely be dismissed on the grounds that none of them are warranted. And we all should be strong proponents for now and forever of vaccinating our children.